This is the Fox 28 Morning Show, when you want it.
Yeah, you know, we all have that one food that we think we could eat all day, every day. And I'm sure most of us at one point or another have eaten much more than we should have. But as Fox's Julie Banderas explains, if you're on a level of binge eating, it could be impacting your health in the long run.
52-year-old Ken Stewart works out almost every day. He takes dance classes regularly and watches what he eats during the day. But he has a secret. He's a binge eater.
It's nothing to literally eat a whole cake and a pint of ice cream in about 20 minutes and then want more, and you should go and get it.
Ken is not alone. Millions of people face this problem. Binge eating is defined as eating a larger than normal amount in a 2-hour time frame 3 or more times per week. Registered dietitian Marjorie Cohn says some patients eat as much as 20,000 calories at once.
When you look at the typical binge foods, which are concentrated sources of calories, sugar and fat, such as ice cream, cookies, cakes, it adds up very quickly.
Ken has been binging for about 2 years. He turned to sweets after he quit drinking for good. Licensed clinical social worker Jennie Kramer says it's common for patients to swap one vice for another.
Food's the weapon. It would be like talking about alcoholism and only talking about the alcohol. You are not addicted to a food per se, but you are addicted to the activity. You're addicted to the habit. You're addicted to the numbing out of all of your thoughts and feelings.
Binging can cause serious physical side effects like acid reflux, digestive issues, diarrhea, and vomiting, as well as long-term health problems. But there is an emotional toll as well.
It's almost like I'm not myself when it's happening. And then I feel stupid afterwards. I'm like, that's the last thing I needed. I worked out really hard today. I ate really well today. I was busy today. And then I just spoiled my day.
Treatment includes cognitive behavioral therapy, group therapy, medical assessments, and nutrition training. Ken says going out to eat with friends can be a daunting task, which Marjorie says is a big pitfall for many binge eaters.
This is about how much we should have as a side to this particular sandwich. Making sure that a binge eater eats enough when they are out in a social setting is what's actually going to help them when they go home and they're alone to not binge. And this is a complete meal as is, so I would either ask for a half portion or omit it. Sometimes when you don't have something, you don't really miss it.
Marjorie also suggests bingers use grocery delivery services and buy single-serve food items to help curb binging. But there's no quick fix.
Relapse, I'm afraid, is inevitable. I think people come in thinking, I'll just be cured and that will be that. If only. You didn't get this way overnight. You're not going to become different overnight, but there are benchmarks.
Yeah, I do miss it. I don't have french fries with my burger.
Oh, you do. You miss, yeah, I miss the taste and the texture, right? It's 8:48.